as usual, no diagnosis. You have to make your diagnosis. You have a 4-year-old male. Origin, the family is from Asian origin. In the emergency room. Of course, it's going to be Pete's emergency room, right? What is the problem? The mother said the kid is being irritable for a couple of weeks, at least 1 week. All right? He's not eating, so decrease oral intake. Then you ask the mommy, what else has she seen? Say pink eyes. You get some clue? These are buzzwords. If I'm setting the question, this is the way I would do it. 4-year-old from Asian origin in the emergency room, irritability, decreased PO intake, and a pink eye. Where? Both sides. Then mother said when you look at the kid neck, you saw a very enlarged lymph node in the cervical region. Right? They are in the cervical region. And you ask the mommy, hey, why is the kid not eating? So why not PO intake? The mother said, well, it's because his tongue is big and is red. And a clue, his lips are all chapped. And there's some cracks. And after probing, you probe. The mother said, hey, she saw some rash that started from the head to down to lower extremities. He's a kid from Asian origin in emergency room, irritability, cannot take anything. He has pink eyes on both sides. His lymph nodes are all big. He can't take anything. Why? Because his tongue is really big. He has chapped lips, cracks everywhere. And then they find some rash from the head to the lower extremities. Any clue? The rash was red. And then when you examine the kid, the hand and feet, it's all like swollen. Yeah, you know that something is not good. When you're swollen, that means you have albumin problem. Right? Both hands and feet are all swollen. Any clue? Yeah, he has an albumin problem. Do you want to fix this kid? I think so. And the nurse was nice enough to give you some vitals. So you, the nurse, you took the temperature. And it was 104. And the mother said, oh yeah, I remember. This has been going on for like 7 days. This is the way they will present it for you. I don't want to give you the way, but this is the way. When you're reading a case study, this is what you do. You just go through, look for the buzzword. You said, oh, this is a puzzle. A go to B and C and D. Then I figure out you should be able to make a diagnosis if I present this case. This is like most common cases, but they're not going to tell you from the beginning. They will go through this story I'm telling you. You have to fish out those information, learn how to do these cases. You get 6 points 3, 15 points. Some of these 6 cases is like 18, 20 points. You're going to pass the exams if they give you 3 of them. Right? So he's been having fever for 7 days. And then you went back, you said, whoa, what is going on? I see some pattern. Okay, I see a pattern going on here. You said, well, what is going on? I have a fever, right? And then I look at the neck and the eyes, I see the pink eyes. So I have a C here, I have a T, right? And then you saw the rash, right? That's an R. And A, the cervical lymphadenopathy from here. And the mouth is all swollen, that's your M. With the big tongue, that's your S. Me, I call it TCREAMS. Right? This is temperature. It has to be greater than 5 days. If it's not Kawasaki. This is key. If you don't have temperature more than 5 days, you don't have Kawasaki. Once again, if they give it to you and the temperature is less than 5 days, it's not Kawasaki disease. Conjunctivitis. And this is bilateral. And they have this rash. It's erythematous. They have edema of the hands. And their lymph node, this is adenopathy. It has to be greater than 1.5 centimeters. If it's not Kawasaki, huge ones. They have mucositis. And then they have strawberry tongue. This is Kawasaki disease. So it should not be that hard for you to make that diagnosis. The only thing they're going to ask you is what I'm going to tell you. If they give you this case, they have no choice, okay? Certain things follow. That is science. They have to figure out if you understand the pathophysiology of the disease. And what is the problem with this problem? What is it? It's just vasculitis of the small vessels. So you have inflammation of the small vessels, medium small vessels. That's the main problem that is affecting this problem. Okay, so it's vasculitis. Okay, vasculitis affecting the medium to the small vessels. Right, that's the main problem. And this vasculitis, what would it lead to? Inflammation. So this is the vessel. The vessel get inflamed. If it get inflamed, see what I'm going to do. It's going to get weak. The vessel will be weak. When it's weak, all the pressure that goes to the wall, you form a balloon. It look like that. And this is your aneurysm. And this aneurysm, when blood is flowing, it's not, the blood has so many ways to go. There's so much turbulence. They have turbulence in the flow. When you have turbulence in flow, this is how you form clots. So they have thrombosis, they will form clot. So they will form clot. And when they form clots, they have what? Blood clots in the coronary disease, and that will lead to myocardial infarction. So myocardial infarction. Therefore, the problem is aneurysmal formation leading to turbulent blood flow, forming clots, and then you have myocardial infarction. These are the two complications of this problem. They will not present all like that. There are stages. Okay, so there's 3 stages of this disease. The first stage is the acute phase. That's what we saw. And this is really like 1 to 2 weeks. That's when they come in. And they're going to have inflammation of the vessel. So a lot of inflammation. Okay, they will have fever that does not go away. And they will have irritability. That's the acute phase. Then there's a subacute. That means when everything is resolving. This is where you want to prevent that. You want to prevent subacute state. And that is the 2 to 4 weeks. So we want to cut them from going to 2 to 4 weeks. Otherwise, their skin is going to peel. Okay. And when his skin starts to peel, the fever will resolve and they already form aneurysm. The last stage is 4 to 8 weeks. That's the convalescent state where the disease process basically goes away. So the disease process goes away in the convalescent stage. And that is the 4 weeks to 8 weeks. Once again, let's go back. So this is the 3 stages. Let's go back to the pathophysiology. You have the blood vessel. This is the blood vessel. And you have a bunch of inflammation around it. Bunch of inflammation. What is going to happen? You weaken the vessel and you form a balloon aneurysm. Still, there's inflammation there. Blood flow in aneurysm is not smooth. Blood come here and you go different direction. Different direction. And these different direction leads to thrombosis. So you have inflammation problem and you have thrombosis problem. This is all the treatment is based on. So if this patient is in your hospital and you are the nurse, what do you want to do? 1, he has fever for 104. He does not want to eat. Decrease PO intake. Force them to eat, drink. So give them fluid, drink. Encourage PO intake. They need to have fluid. If they need to put IV in, yeah, put it in because of all the fever, hydration. So they need some hydration. You have to encourage them to do that. What is going to kill them? Break this chain, inflammation and thrombosis. We got to break both chains. That is all. That is the treatment for this, and that's what you're going to ask you. Break the inflammation that prevents thrombosis. How do you do that? 2 options, IV, immunoglobulin. This is a form of antibiotic that, or albumin basically is a form of antibiotic that prevents inflammation. So it decreases inflammation. And it cut down the fever. This is going to prevent aneurysmal formation. That's the key. That means so far as this kid is having fever, is forming an aneurysm. That is the key you have to. If you have fever, you're forming an aneurysm. So we give you this to prevent that. What medication do you know that can prevent thrombosis? It's no brainer, right? You don't have to memorize it. So you get high dose aspirin. This is also going to prevent the thrombosis. And also take care of the fever. Very important concept. That's why we treat them like that. So far as they having fever, they having aneurysmal formation, and they're going to form thrombosis. This is the pathophysiology of the problem. That's all. Now, pay attention. The immunoglobulin is a protein. Okay, so the immunoglobulin, you have to know this information because they can ask you. This is a form of protein. You can also ask an antibiotic, right? If I give you a bunch of protein, which is an albumin, what does it do? Check my IV fluid, electrolyte. So this is the vessel. If I put albumin inside, it's going to pull fluid. Albumin will pull fluid into the intravascular system. And what would it lead to? Massive fluid. So you're going to have like fluid being pulled into the system. You have massive fluid overload. But why you give them albumin? Because they're swollen. So you're pulling the fluid out of the extravascular system into the intravascular system. All the edema that they have, the albumin is also taking care of it. And they have massive fluid overload. Which two organs is going to be in trouble? Think about it. All of a sudden, you have too much fluid in the intravascular system. There's two organs that is going to be in trouble. Who is that? Which organ will be in trouble in your system? What? Your heart and your lungs. Those are the ones you watch for. Every time you give somebody immunoglobulin, look for this, the heart and the lung. So they can go into CHF, side effect of the medication. They can go into lung. They go into what? Pulmonary edema. You should expect them to take you to heart failure. What signs and symptoms you should see in heart failure? What signs and symptoms you see in lung and pulmonary edema? For this one, your B-sharp moment is what? What is your B-sharp moment? This is pink, fruity sputum. If you see that, they are in pulmonary edema. So those are the things you focus on. So there's fluid overload, there's heart failure, pulmonary edema in this patient. If you give them immunoglobulin. What else is the problem? It makes you immunocompromised. Therefore, you should not get no live vaccine. There's always a reason why all the things you see about this disease, it makes sense. You should not get live vaccine because immunocompromised at least 6 months. What are those live vaccines? The nasal flus. You should not get the MRI. The oral form of polio. These are examples of live vaccines. So these kids should not do that. So side effect of immunoglobulin, heart failure, pulmonary edema, and making immunocompromised. Therefore, you should not get live vaccine. This is key, right? That's the key for that problem. Okay. Somebody will say, well, why are you giving the kid aspirin? He has a viral infection. It's a viral infection. You should not give them aspirin because they will develop what? Reye syndrome. Then your answer is, if you see it in the case form, you said the risks and benefit. Risks and benefit. The benefit outweigh the risks. So I will take the benefit over the risks. Why? Do you want to have a 4-year-old with aneurysm that can burst and develop heart attack and die? rather than having a Reye syndrome. It's easy. I'd rather take a Reye syndrome over what? Over having aneurysmal formation that can cause a problem and I will die from it. So why did I say that? Somebody will argue. This is what I believe. So this is what I believe. What is Reye syndrome? It's acute liver injury. It's an acute problem, right? The kid is what, 4-year-old. There's mother there. What do you think? The mother is going to watch this kid, right? She's going to watch this kid. We cannot say the aneurysmal formation that is going to happen. We got to get an echo. If I can see something, I can observe it. I have to get images multiple times. So echocardiogram to see what is going on. But for Reye syndrome, mommy should be able to figure it out. How? How would he present? Remember, this is a 6-case study. They can take you everywhere they want. So don't limit yourself, spread your wing. So every disease process, know the pathophysiology and where. If there's a pharmacological thing, they will take you there. How would you know? The mother, well, mommy, I want you to check for confusion. If the kid is confused, let me know. What else do you check for Reye syndrome? It says it's a hepatic liver injury, acute liver injury. You should know this by now. Cirrhosis, features of cirrhosis, acute encephalopathy is going to be the same. You don't have to memorize. You should bring whatever you learn from GI here, right here. Confusion. You're going to have a slur speech. It's confusion, brain problem. It's an encephalopathy. So if they give you answer choices, look for signs and symptoms of brain dysfunction, right? If you're confused and you have slurred speech, usually you become lethargic. Acute phase, the kid will not have the chance to become jaundice. So there won't be to acute phase. It just happened right away. It will take some time for that to, the most common things you see, confusion, slurred speech, and lethargy. But then when you examine them, you know what to expect, right? What do you expect? I'm showing you how, if you know your stuff, you can branch to any point. You should watch. I have a video. It talks about learning in system. Learn in system and don't limit yourself. When you study pharmacology, don't just study pharmacology. If I give you a PPI and you study, you should not stop there. Go all the way to the system, how PPI affect the GI tract. You can go to the infectious disease. I can show you PPI. When you're in PPI, you can develop, I'm digressing, but I need to show you that PPI. What is the side effect? Osteoporosis, chronic PPI. You can have C. diff, infection, and pneumonia. Where are we led to? Infectious disease and musculoskeletal. You see how the system is connected? There's nothing in vacuum. Our body working in unison. So for this patient with lethargy, think about what? Musculoskeletal system. That is the way you diagnose this. What do you ask the kid to do? What do you think? What musculoskeletal manifestation of this problem, acute liver injury, would you see? It's a musculoskeletal problem. What do you guys think? What are you? It's something that I'm thinking that you should be thinking. Acute hepatic encephalopathy, confusion, slurred speech, lethargy. What do you see? What are you going to ask this kid to show you that they have really bad liver injury? Right? And that's what you see. The flapping tremor. And what is that? There's a word for it, right? You see flapping tremor with outstretched hand. And that is how you can make the diagnosis that this kid is in encephalopathy. It's no Corey. Corey is a Sodona Corey, that snake-like movement. This one, they stretch their hand and they flap. It's called asterixis. And that's what you're going to see. We'll come back to that. What else do you do? The most important, you tell the mother, I want you, the mother, when you go home, this is the nursing instruction, teaching. I told you the key is if there's fever, we're having aneurysm. That is the key. Therefore, I want you to check the 48 hours that you are home, every 6 hours, check for fever. And call me when the kid still has fever, if still fever, because things are not going well. And then you have to tell the mother to encourage PO intake. That strawberry tongue needs to die. So we got to give you fluid so that you can do much better. You can hydrate yourself. We can send you on with IV fluid. So those are the teaching you tell the mother. What else do you think they will order at home? When the kid is going, they will tell the kid to follow up. They will do some studies. They will do some imaging. They want you to follow up with that. How would I know that the kid has aneurysm? Like I told you, don't memorize this concept. When you see a study and I give you option, and I said X-ray, CT scan, echocardiogram, which one would you choose? Which one do you think this kid need? Or barium enema? Which one would you choose? What do you think? What study will you order for this kid to follow up when they go home? Tell mommy to get it done so that we can follow up with stuff. Of course, it's no brainer, right? This is a select or apply. X-ray, I give you X-ray. Mommy, go get an X-ray or CT scan or echocardiogram or barium enema. Which one is the most important? Of course, we got to look at the aneurysm. So we choose echocardiogram. That is your best study, right? Echocardiogram. Echocardiogram is the best study to look at the aneurysmal formation. Right. Now, let's go back to this encephalopathy. So you're going to see asterixis as your motor function. That tell you very bad brain function. What is your treatment? Acute encephalopathy in a young kid. What is your treatment? Before that, what lab work you do? If I do a lab work right now, I'm going to see AST is going to be high, ALT high, ammonia is high. That's my key. This is why the kid is behaving this way. It's lethargic. It's because of that. Now, how do we treat this? What medication will you give him, the kid? I know we're talking about Kawasaki, but I'm telling you, this is part of the disease. They said, well, the kid developed all this thing. What were you going to do? It's another disease process now. What are you going to do? Now, he has encephalopathy. What will you give this kid? What medication are you going to give the kid? Pharmacology, right? What medication would you provide for the kid? The kid is going to get what? Lactulose. Well, don't expect them to leave you like that. There's another medication, they may not give it to you. rifaximin. Okay, so you have to know this one too, in case they don't give you. So we use it for encephalopathy, but they're not going to leave you here. They can dig deeper. Lactulose, fact about lactulose. How do you give it? You let the kid drink it with food. You put a straw in it. You mix it with juice. What do you want to do? You can give it with milk. It does not taste good, but you can give it with milk and fruit juice. That's all. Or you take it empty stomach. Pharmacology right there. This is how you take it. Don't mix it with any food except milk, fruit juice, or empty stomach. How do you give it? Which route do you give it? Enema? Oral? You can give it enema by enema or oral. What do you do when you give it to the kid? What are you looking for? What instruction you think the doctor will order? This is a laxative. People don't know it's a laxative. I can't give you something and just be peeing on yourself or having a lot of bowel movement. So I have to have criteria I have to look for. So what do you tell the nurse? What do you tell the nurse to look for? I give you lactulose. What do you look for? I want you to do this and that and that. What instruction do you think the nurse will be looking for? How do you know this is therapeutic? What are you doing? You don't just give lactulose, you titrate. To what? Titrating to what? 2 to 3 bar movement. I want you to do that, 2 to 3 bar movement. Anything more than 3 bar movement, greater than 3 bar movement, is a B-sharp movement. If you don't know B-sharp, check adapt and close. This is your prioritization strategy. It just makes you focused. You know what you should pay attention to. There's no magic to it. Things you need to worry about, things you should be focused, it just keep you focused. And when you see that, you know this is not right. Right, 2 to 3 bar movement. But if they have more than 3 bar movement, it's a B-sharp movement. Why? Why is it a B-sharp movement? Because this is a laxative. And what is in the laxative? Potassium, low. Sodium, high. This is what is going to happen. Lactulose causes hypokalemia and hypernatremia. You want the kid to have hypokalemia in a heart problem patient. That's why it's a B-sharp movement. More than 3 bar movement, you got to intervene. Check adapt and close, you know what the B-sharp is. Like I said, it's your best prioritization strategy. How would you know the kid is doing fine? Well, the asterixis will go away. That's what you look for. This will go away. Confusion will go away. It will get better. And what lab work you're going to check? Your ammonia. And that will go away. So don't limit yourself. And this is the disease process that you should pay attention to. So Kawasaki disease is a vasculitis, that's all. Inflammation of the small vessels. I don't think they will take you here. Recently, we know it's associated, there's some few cases associated with COVID-19. It does not mean that it's causing it by kid with association. I don't think there was examiners have good evidence to take you there. If in case you see it, yes, there's a possibility associated with COVID-19 where they will show up like that. They will have Kawasaki-like symptoms. TCREAMS, I call them. Fever more than 5 days, bilateral conjunctivitis, a rash that starts from the head. They have edema of both hands, adenopathy greater than 1.5 centimeters, mucositis, and strawberry tongue. And you have to manage them by giving them what? Aspirin and what? Immunoglobulin. Why? Because you want to prevent inflammation. And immunoglobulin, there's side effect, pulmonary edema, CHF, and then you have to avoid rifaximin. Aspirin, there's also a problem, Reye syndrome. You should be able to manage it, able to recognize it. And what you tell the mommy, I want you to check temperature for 48 hours. If you still having fever, let me know so that we can come in. You need to get echo. And another important information, kid, even though the tongue is swollen, I want you to drink. There's no way if they give you this case, you're going to miss it. Kawasaki disease. Straightforward. Take care of yourself. And thank you for sticking around. If you've not subscribed, please subscribe to Adapt and Close and check Adapt and Close. You see a video like that, Jones and sandpaper rash, which are buzzwords for a certain disease process. In addition to Kawasaki, it's an NGN video. You will never find it anywhere. And that's the way they will present it to you. Be good. All the best of luck and good luck in your exams. Take care.